6 diabetes emergency signs you need to know. But what happens when something goes wrong? What do you do when symptoms of high or low blood sugar become life-threatening? That's exactly what we're diving into today. In this video, we're going to discuss 6 diabetes emergency signs you absolutely need to know. The warning signals that indicate when your blood sugar has reached a dangerous level and immediate action is needed. These are the symptoms that you can't afford to ignore, because they can lead to serious complications, and in the worst-case scenarios, they could even be life-threatening. From extreme thirst to unconsciousness, knowing what to look for can make all the difference between a quick recovery and a potentially dangerous emergency. We'll cover the key symptoms that can indicate things are getting out of control with your blood sugar, and how to recognize them before they escalate into something more serious. This isn't just about knowing what's happening in your body. It's about taking action quickly so you can protect yourself and stay in control of your health. So if you're ready to learn the crucial signs that could save your life or the life of someone you love, make sure you stick around to the end of this video. And if you're new to the channel, don't forget to hit that subscribe button and turn on notifications so you never miss out on more helpful tips like this one. Let's jump right in and break down the 6 diabetes emergency signs you need to watch out for, because your health is too important to leave to chance. Number 1. Extreme thirst and frequent urination. If you've ever experienced extreme thirst paired with the constant need to run to the bathroom, you know how uncomfortable and concerning it can be. But did you know that these symptoms could be a sign of an impending diabetes emergency? When blood sugar levels rise too high, whether due to uncontrolled diabetes or insulin resistance, it can lead to a condition called hyperglycemia. And one of the first signs of this dangerous situation is extreme thirst and frequent urination. But why does this happen, and what can you do about it? Let's break it down. Normally, the body regulates blood sugar through insulin, which allows cells to absorb glucose from the bloodstream. However, when the body isn't producing enough insulin, or the insulin is not functioning properly, glucose builds up in the blood. This excess sugar creates a hyperosmolar state, which means the blood becomes more concentrated with glucose. The kidneys, which are responsible for filtering out waste and excess substances from the blood, work overtime to try and remove this excess sugar through urine. This leads to increased urination, as the kidneys are essentially trying to flush out the glucose. Now, as your body loses more water through frequent urination, it begins to get dehydrated, which triggers the feeling of extreme thirst. Your brain sends signals to drink more water, hoping to replenish lost fluids. This is your body's natural defense mechanism to prevent dehydration. However, the cycle can become dangerous if left unchecked. As you urinate more and drink more to compensate, you're still not addressing the underlying cause of the problem: high blood sugar levels. This vicious cycle of thirst and urination can leave you feeling exhausted, weak, and disoriented. But the problem doesn't stop there. If this condition continues unchecked, it can eventually lead to more severe complications like diabetic ketoacidosis, DKA, in type 1 diabetes, or hyperosmolar hyperglycemic state, HETS, in type 2 diabetes, both of which are medical emergencies that require immediate intervention. In fact, persistent high blood sugar can even cause kidney damage over time, so it's critical to address these symptoms as soon as they appear. You're noticing extreme thirst and frequent urination. It's a sign that your blood sugar may be out of control. Test your blood sugar immediately to see if it's elevated, and if it is, take action. Whether that means adjusting your medication, checking your insulin doses, or seeking medical attention. Remember, these symptoms are a warning sign that your diabetes may need better management or that something may be wrong with your treatment plan. So if you're feeling thirsty all the time, running to the bathroom constantly, and just can't seem to quench your thirst, don't ignore it. Pay attention to these warning signs of a potential diabetes emergency. Taking control of your health by staying on top of your blood sugar levels and recognizing these early signs can help prevent serious complications and keep you feeling your best. Number 2, rapid breathing or shortness of breath. If you've ever experienced rapid breathing or a feeling of shortness of breath out of nowhere, you probably felt alarmed, and rightly so. For individuals with diabetes, this could be a major warning sign that something serious is going on. While it's natural to feel winded after intense physical activity or exertion, shortness of breath accompanied by rapid breathing when at rest could indicate that your body is struggling to manage high blood sugar, and it could be a sign of a diabetic emergency. When blood sugar levels spike to dangerous heights, the body begins to shift into a state known as diabetic ketoacidosis, DKA, which is a life-threatening complication typically seen in people with type 1 diabetes, though it can occasionally affect those with type 2 as well. Here's why this happens. When your blood sugar is high, but your body is unable to use glucose for energy due to a lack of insulin, it turns to fat for fuel. As fat is broken down, it releases ketones, which are acidic byproducts. These ketones build up in the bloodstream and cause the blood to become acidic, leading to what's known as ketoacidosis. As your blood becomes more acidic, your body's normal processes become compromised, and the respiratory system kicks into action. To try to bring the pH levels back into balance, your body attempts to exhale the excess acid through rapid, deep breathing. This is known as Kussmaul breathing, and it's a clear signal that your body is in crisis. Rapid breathing, along with shortness of breath, is your body's emergency response to combat this dangerous acid buildup. This can feel like you can't take a full breath, or like you're gasping for air, even when you're not doing anything physically demanding. But rapid breathing and shortness of breath don't just occur in DKA. They can also be warning signs of another diabetes condition called hyperosmolar hyperglycemic state, HHS, which is more common in type 2 diabetes. In HHS, the blood sugar levels are extremely high, but the body doesn't produce ketones like in DKA. However, just like in DKA, the body becomes severely dehydrated and attempts to compensate by breathing rapidly. While the mechanisms behind HHS are different, the end result is still dangerously high blood sugar and a need for immediate medical attention. If you notice rapid breathing or shortness of breath, don't dismiss it as just a passing moment of anxiety or a random occurrence. These symptoms are serious, and they are often accompanied by other signs such as nausea, vomiting, confusion, or a fruity odor on the breath, another hallmark sign of diabetic ketoacidosis. This is not something you want to wait out. Get help immediately if you experience this symptom, as DKA and HHS can both be life-threatening if not addressed quickly. The key takeaway here is that shortness of breath and rapid breathing are more than just discomfort. They are signs of a medical emergency. If you have diabetes and experience these symptoms, it's crucial to check your blood sugar levels, stay hydrated, and seek urgent medical care. Early intervention can prevent these complications from escalating, helping you avoid long-term damage and ensuring your health is on track. By staying vigilant and recognizing the signs of high blood sugar and ketoacidosis, you can protect yourself and prevent these dangerous episodes. Managing your diabetes well, keeping blood sugar levels in check, and paying attention to any unusual symptoms like rapid breathing can make all the difference in staying healthy and avoiding emergencies. Number 3, confusion or difficulty concentrating. Have you ever suddenly felt like you can't focus, your thoughts are foggy, or you can't seem to concentrate on anything? If you're living with diabetes, this feeling of confusion or difficulty concentrating could be a red flag that something is wrong with your blood sugar levels. This is one of the lesser discussed yet critical symptoms of both hypoglycemia, low blood sugar, and hyperglycemia, high blood sugar, both of which can have significant effects on your cognitive function and overall brain health. Let's first talk about hypoglycemia. When your blood sugar drops too low, often below 70 ml/dl, your brain doesn't have enough glucose to fuel its normal activities. Glucose is the brain's primary source of energy, and without it, you can start to experience symptoms like dizziness, shakiness, and the inability to focus. As the glucose shortage worsens, confusion and a general sense of mental fog can set in. This isn't just a momentary lapse in concentration. It can become severe mental impairment. When hypoglycemia progresses, it can make it feel like you're in a daze, and you may struggle to complete simple tasks or process information clearly. It can even lead to more extreme symptoms like slurred speech, difficulty walking, and in some cases, unconsciousness. On the flip side, hyperglycemia, when your blood sugar is too high, can also interfere with your cognitive function. When blood sugar levels are elevated, your body tries to get rid of the excess sugar by excreting it through urine. This leads to dehydration, which impacts the brain and other vital organs. As dehydration increases, you may find it harder to concentrate, and the brain begins to feel sluggish or even disoriented. The excess sugar in the bloodstream can also create an environment of increased inflammation, which directly affects your neurological function, contributing to that mental fog and confusion. Your brain is basically working overtime trying to manage an overload of sugar, and that can make thinking clearly almost impossible. In addition to cognitive effects, confusion and difficulty concentrating can be a sign of more serious complications, like diabetic ketoacidosis, DKA, or hyperosmolar hyperglycemic state, HHS, both of which require immediate medical attention. DKA, for example, is a condition where the body starts to break down fat for fuel because it can't use glucose due to a lack of insulin, creating a dangerous buildup of ketones in the blood. These ketones not only acidify the blood but also impair brain function. In both DKA and HHS, the confusion and difficulty concentrating can become so severe that you may not even be able to recognize that you need help, which makes these situations all the more dangerous. So what should you do if you notice confusion or a lack of focus? The first step is to check your blood sugar. If it's low, consuming a quick source of sugar like a glucose tablet, juice, or a small snack can help bring your levels back into a normal range. If it's high, drinking water and checking your ketone levels can be an essential step toward rehydration and stabilizing your blood sugar. It's also important to make sure you're managing your diabetes properly, whether through medication adjustments, diet, or lifestyle changes, to prevent these types of episodes from happening in the first place. But most importantly, don't ignore it. Confusion and difficulty concentrating might seem like a small thing, but in the world of diabetes, these cognitive issues are often the body's way of signaling a dangerous imbalance. By addressing blood sugar fluctuations early, you can prevent more serious complications and keep your brain sharp and focused, ensuring you stay on top of your health and well-being. To sum it up, confusion and difficulty concentrating are more than just an inconvenience. They are critical signs that your blood sugar is off balance, whether it's too low or too high, and your brain is telling you that it's struggling. So next time you feel your mind wandering or you can't focus, don't just brush it off. Take a moment to check your blood sugar, drink some water, and pay attention to what your body is telling you. Now, it could be the first step in avoiding a serious diabetes emergency. Number 4. Blurry vision. If you've ever experienced blurry vision, you know how unsettling it can be. Everything seems out of focus, and it feels like your eyes just can't quite make out the details in front of you. But for individuals with diabetes, blurry vision is more than just a minor inconvenience. It's often a sign that your blood sugar levels are out of control. In fact, one of the first symptoms of uncontrolled blood sugar, whether it's too high or too low, can be blurred or distorted vision. Let's take a closer look at why this happens and what it means for your health. When your blood sugar levels rise significantly, whether due to hyperglycemia, high blood sugar, or diabetic ketoacidosis, DKA, it can lead to an imbalance in your body's fluids. High blood sugar draws water out of your cells, including those in your eyes, leading to dehydration. The lenses of the eye rely on proper hydration to stay flexible and maintain their shape for clear vision. When the eye's lenses are affected by dehydration, they can swell and change shape, causing blurry or distorted vision. This is why many people with diabetes often notice temporary blurry vision during periods of high blood sugar. Blurry vision due to high blood sugar is typically a short-term issue, and once blood sugar levels are brought back into balance, vision may return to normal. However, if hyperglycemia continues unchecked over an extended period, it can lead to more permanent damage to the blood vessels in the eyes, a condition known as diabetic retinopathy. This is one of the most common and serious complications of diabetes, and it can lead to permanent vision loss if not addressed. In diabetic retinopathy, the high blood sugar causes the blood vessels in the retina, the light-sensitive tissue at the back of the eye, to weaken, swell, or leak, leading to vision problems like blurry vision, dark spots, or even blindness. This is why it's critical for people with diabetes to regularly monitor their blood sugar levels and get routine eye exams to catch any potential problems early. But blurry vision isn't always due to high blood sugar. If your blood sugar drops too low, a condition known as hypoglycemia, you can also experience blurry vision as a result of the brain not getting enough glucose to function properly. When glucose levels are insufficient, the brain struggles to process visual information, leading to difficulty focusing or seeing clearly. This is why hypoglycemia can sometimes cause people to feel dizzy or experience vision disturbances, especially if they're on the go or engaging in activities that require focus, like driving or working. Blurry vision can also be an early warning sign of more serious issues related to diabetic complications. As mentioned earlier, untreated high blood sugar can lead to diabetic retinopathy, but it can also increase the risk of developing cataracts or glaucoma, both of which are eye diseases that can cause vision loss. Cataracts occur when the lens of the eye becomes cloudy, leading to blurry or dimmed vision, while glaucoma causes damage to the optic nerve, leading to peripheral vision loss and eventual blindness if left untreated. So, what should you do if you experience blurry vision? First and foremost, check your blood sugar levels. If they're high, take steps to bring them down with insulin, hydration, or the adjustments recommended by your healthcare provider. If you're experiencing blurry vision during periods of low blood sugar, treat it with a quick source of glucose like juice or glucose tablets. But if blurry vision becomes a persistent problem, or if you experience other symptoms like eye pain, sudden vision loss, or difficulty seeing in dim light, it's crucial to see a doctor or ophthalmologist immediately. Regular eye exams are vital to catch any signs of diabetic retinopathy, cataracts, or other eye conditions before they cause irreversible damage. In conclusion, blurry vision should never be ignored, especially if you have diabetes. It's a warning sign that your blood sugar may be out of control, and it can indicate that your eyes or even your overall health are at risk. Whether it's temporary due to high or low blood sugar or a more serious long-term complication, paying attention to blurry vision can help you catch potential issues early. So, if you experience it, don't just brush it off. Take action, check your blood sugar, and consult with your healthcare team. Your eyes and your health will thank you for it. Number 5, nausea and vomiting. If you've ever experienced nausea or vomiting, you know how uncomfortable and distressing it can be. But when it comes to diabetes, these symptoms are more than just an upset stomach. They can be indicators of a serious complication that requires immediate attention. Whether your blood sugar is too high or too low, nausea and vomiting are signs that your body is struggling to maintain balance. and these symptoms should never be ignored. So let's break down why these two seemingly simple symptoms can be a major red flag for someone with diabetes. First, let's talk about hyperglycemia, or high blood sugar. When blood sugar levels rise significantly, especially in the case of diabetic ketoacidosis, DKA, which is a life-threatening complication of type 1 diabetes, your body begins to break down fat for energy instead of glucose. This process produces ketones, which are acidic byproducts that build up in the blood. As ketones accumulate, they make the blood more acidic, which leads to a condition called metabolic acidosis. This acidic environment wreaks havoc on your body's organs, including the stomach, leading to symptoms like nausea and vomiting. The nausea is your body's way of trying to purge the harmful effects of the ketones, and vomiting is your body's attempt to rid itself of excess waste. But nausea and vomiting can also occur in situations where your blood sugar is too low, a condition known as hypoglycemia. When blood sugar drops too low, your body doesn't have enough glucose to fuel essential functions, and this can send your body into a state of distress. In response, the body releases adrenaline to try and raise blood sugar levels, and this rush of hormones can trigger symptoms like nausea and even vomiting. The body is essentially in fight or flight mode, trying to correct the blood sugar imbalance. While this is a defense mechanism, the upset stomach that results can leave you feeling dizzy, weak, and unable to keep food or fluids down. When you experience nausea and vomiting with diabetes, it's critical to consider the cause. If your blood sugar is elevated, particularly in the case of DKA, these symptoms may be accompanied by other signs such as abdominal pain, fruity-smelling breath, or shortness of breath. These are warning signs of a more serious problem, and seeking medical attention immediately is crucial. DKA can quickly escalate into a medical emergency if not treated, as it can lead to dehydration, organ failure, and even coma if left unchecked. On the flip side, if nausea and vomiting occur during hypoglycemia, it's essential to treat the low blood sugar immediately. Symptoms like dizziness, confusion, and nausea can often be alleviated by consuming a fast-acting carbohydrate, such as juice or glucose tablets, which will quickly raise blood sugar levels back to normal. If you don't address the low blood sugar promptly, it can continue to worsen, leading to further complications and more severe symptoms like loss of consciousness or seizures. But what if nausea and vomiting persist, even after addressing blood sugar levels? If these symptoms are ongoing or you can't seem to find relief, it could indicate a diabetic complication that requires medical attention, such as gastroparesis. Gastroparesis is a condition where the stomach takes longer to empty its contents, leading to chronic nausea, vomiting, and bloating. It's a condition that affects the digestive system and can be caused by long-term high blood sugar, damaging the nerves that control the stomach muscles. If you have diabetes and experience chronic nausea, it's important to work closely with your healthcare provider to manage this condition and prevent it from interfering with your daily life. Ultimately, nausea and vomiting are symptoms that should never be taken lightly when managing diabetes. They are often signs that your blood sugar is out of control, either too high or too low, and are your body's way of signaling that something needs to be addressed. Whether it's treating a blood sugar imbalance, rehydrating to prevent dehydration, or managing a chronic condition like gastroparesis, these symptoms are your body's way of getting your attention. So if you're experiencing nausea or vomiting, don't wait it out. Check your blood sugar, hydrate, and take immediate action to stabilize your levels. And if the symptoms don't improve, or if you experience more serious signs like confusion, shortness of breath, or extreme fatigue, seek medical help right away. Recognizing the warning signs of a diabetes emergency can be the difference between a quick recovery and a serious health crisis. Always trust your body's signals, and make sure you're getting the right care when you need it most. Number 6. Unconsciousness or fainting. Unconsciousness or fainting is one of the most alarming and serious signs of diabetes complications, and it can be a life-threatening situation if not addressed immediately. If you've ever witnessed someone faint or pass out due to a sudden drop in blood sugar, hypoglycemia, or a severe rise in blood sugar, hyperglycemia, you know just how frightening it can be. For people with diabetes, these events are often the result of blood sugar imbalances, but understanding why this happens and how to respond can be crucial in preventing serious outcomes. So, let's dive into why unconsciousness and fainting happen and what steps you should take if you or someone you know experiences these symptoms. First, let's consider the situation where blood sugar drops too low, a condition known as hypoglycemia. When blood sugar levels fall to dangerous levels, typically below 70 ppf/dl, the body doesn't have enough glucose to fuel essential organs like the brain, and it sends signals that something is wrong. The brain is the most glucose-dependent organ in the body, and it needs a steady supply of glucose to function properly. When glucose levels fall, the body starts to show symptoms like dizziness, shakiness, and confusion. But as the blood sugar continues to drop, the brain becomes more and more deprived of energy, and it can lead to loss of consciousness. This is why fainting or passing out is a serious warning sign that you've reached a critical level of low blood sugar. The body's natural response to severe hypoglycemia is to protect itself by shutting down non-essential functions, including consciousness, in an effort to prevent further harm. Severe hypoglycemia can be caused by a variety of factors, including skipping meals, excessive insulin doses, or intense physical activity without proper nutrition. It can also occur if you delay eating after taking insulin or drink alcohol without compensating with food. Regardless of the cause, when someone loses consciousness due to low blood sugar, it's a medical emergency, and immediate action is needed to raise blood sugar levels. If left untreated, severe hypoglycemia can lead to seizures, coma, or even death. On the flip side, hyperglycemia, high blood sugar, can also cause a person to faint or lose consciousness, but this typically happens in cases of diabetic ketoacidosis, DKA, or hyperosmolar hyperglycemic state, HHS. Both of these conditions occur when blood sugar levels remain dangerously high for an extended period of time. In DKA, the body starts breaking down fat for energy instead of glucose due to a lack of insulin, producing ketones that make the blood more acidic. As the blood becomes more acidic, it affects blood circulation, oxygen delivery, and organ function, which can result in fainting, confusion, and even loss of consciousness. Similarly, in HHS, which is more common in type 2 diabetes, the blood sugar levels climb so high that the body becomes severely dehydrated, leading to symptoms like weakness, fatigue, and dizziness. As dehydration worsens, the body struggles to maintain proper blood flow to the brain, and this lack of oxygen and nutrients can cause the person to faint or lose consciousness. Both of these conditions, DKA and HHS, are life-threatening emergencies, and they require immediate medical treatment to correct the underlying issue, rehydrate the body, and restore balance. If you or someone you know faints or becomes unconscious due to a blood sugar imbalance, it's crucial to act quickly. If you suspect hypoglycemia, do not attempt to give food or drink if the person is unconscious or semi-conscious, as this can pose a choking hazard. Instead, administer an emergency glucagon injection if available, and seek immediate medical help. If the person is conscious, a quick-acting source of sugar like juice or glucose tablets can help raise blood sugar levels quickly. For hyperglycemia and conditions like DKA or HHS, it's important to call for medical help immediately. If you suspect that the person has DKA or HHS, they will need to be treated in a hospital with insulin, fluids, and electrolytes to bring their blood sugar levels under control and address any complications. IV fluids and careful monitoring are essential to stabilize the body and avoid long-term damage to organs. In conclusion, unconsciousness or fainting are not just dramatic symptoms. They are serious warning signs that blood sugar levels have reached a dangerous level, whether it's due to hypoglycemia, hyperglycemia, or a related complication like DKA or HHS. The brain, deprived of glucose or oxygen, essentially shuts down to protect itself. But it's up to you or those around you to recognize the signs early and take swift action. Never ignore these symptoms and always take them as an urgent call for help. Whether it's through raising blood sugar levels for hypoglycemia or seeking emergency care for high blood sugar, staying vigilant about diabetes management and recognizing emergency signs can prevent serious complications and keep you or your loved ones safe. Summary. Wow! I hope today's video helped you gain a clearer understanding of the 6 diabetes emergency signs you need to watch out for. I know it can be overwhelming at times, especially with all the ups and downs of managing blood sugar levels, but recognizing these symptoms early could be the key to preventing a serious crisis. If you or someone you know is experiencing any of these signs, it's so important to take immediate action and, when necessary, seek professional medical help. Remember, diabetes doesn't have to control your life, but staying informed and aware can make all the difference. If you found this video helpful, don't forget to like, comment, and share it with someone who might need to hear this. If you're new to the channel and haven't subscribed yet, what are you waiting for? Hit that subscribe button and turn on the notification bell so you never miss out on videos that can help you live a better, healthier life with diabetes. Also, if you have any questions or want to share your experiences, feel free to drop a comment below. I love hearing from all of you and answering your questions. And if you want more in-depth guides on managing diabetes, be sure to check out the videos popping up on your screen right now. They're packed with tips, tricks, and advice to help you take control of your health. Thanks for watching, and remember, stay safe, stay informed, and I'll see you in the next video.